Hi, I'm Dr. Green. Welcome to your cranial nerve exam. I would like to tell you a little bit about the exam that we're doing today, how it works, what we're looking for. If you wouldn't mind taking a look at this image real quick for me. All right. Now, we have a whole complex network of nerves running throughout our body, and it's their job to carry information and instructions between our brain and all the other parts of our body. We have different types of nerves. We have motor nerves, and motor nerves carry instructions from the brain to elsewhere in the body, okay? So, for example, if you are walking through a store and you see a really soft, fuzzy-looking blanket, and you decide you want to touch the blanket, okay? The whole process of extending your arm and hand and using your fingers to stroke the blanket, that's your motor nerves at work. Your brain instructing your muscles how to move, okay? Then we also have sensory nerves, and they carry sensory information up to the brain. So if you touch that really fuzzy blanket and you think, oh, that is so soft, that's your sensory nerves at work, carrying information from your hand up to your brain, okay? Now, we also have some mixed nerves in our body, nerves that do a little bit of both, motor and sensory. And as I'm sure you can imagine, there's a lot more complexity and subtlety to how everything works, but overall those are the basics. Now, we have lots of nerves in our body, but the cranial nerves specifically, they're a set of 12 pairs of nerves that originate up in the brain and the brainstem. They're responsible for a whole bunch of specialized functions. So, your smell, vision, hearing, the movement of your eyes and your facial muscles, your sense of balance. That's your cranial nerves. And it's this particular set of nerves that we will be testing today. All right? So, by name, we've got your olfactory nerves, we've got your optic, oculomotor, trochlear, trigeminal, abducens, facial, vestibulocochlear, glossopharyngeal, your vagus nerve, that's my personal favorite, accessory nerve, and hypoglossal. Don't worry, I'm not going to quiz you on that, and that's not the exact order we're going to go in. I am going to walk you through a whole series of little tests and examinations and instructions. I'll be giving you lots of instructions, but please don't worry if any of them feel a little tricky. It's totally normal for some of them to be easier than others. All we're doing is observing your responses, and we're just going to compare them to your known medical history to see if there are any changes or anything we want to check out further. All right? Many of them will require that I do some touching and palpating, a little physical interaction. I hope that's okay. It's overall going to be a pretty pleasant and easy process, and I will walk you through every step of the way. Okay? All right. Are you ready? Just one moment while I put this away and get my gloves on. So I have these 4 vials of scented liquid. They're each scented pretty strongly. Each one is different. What I'm going to be doing is one at a time. I'm going to hold them underneath your nose, open. I'm going to ask you to take a nice deep breath in through your nose and let me know what it smells like. I am going to tell you ahead of time what each of them is. It's not a test to try and trick you or anything. So I'll let you know what it is. I'll hold it under your nose. You'll take that nice deep breath, and then you'll let me know whether just, yes, it smells like what it's supposed to, or if it smells like something different. Please let me know. If you can smell it, but it seems faint, like not that strong of a smell, that's something I want to know as well. All right? Great. Okay, so I do have to shake each of them up to kind of make sure the scent is evenly dispersed. Okay. To begin with, can you take a nice cleansing breath in through your nose, out through your mouth. Beautiful. Okay. So this one is vanilla. I'm going to go ahead and hold it underneath your nose here. Nice deep breath in through your nose, out through your mouth. And what do you think? Did that smell pretty clearly like vanilla to you? Okay. I'm going to set that aside and take a quick note here. Next one. Okay. Can you get another cleansing breath in through your nose, out through your mouth? Good. All right. This one is coffee scented. So I'm going to go ahead and hold it under your nose. Please take a nice deep breath in and out through your mouth. Did that smell like coffee? Okay. Great. I'm going to set that aside. Got 2 more. Cleansing breath in through your nose, out through your mouth. Beautiful. This one is mint scented. Okay, so I'm going to place that under your nose. Nice deep breath in through your nose and out through your mouth. What do you think? Did that smell like mint? Okay. Quick note. Okay. Last one, and then we can move on to the next one. Well, the next test. Okay. So, nice cleansing breath again through your nose, out through your mouth. Good. Yeah, we want to clear it out a little bit. Okay. Now this one smells like opportunity, okay? So I'm going to hold that underneath your nose. Can you take a nice deep inhale through your nose and out? Great. Okay. Could you smell opportunity? That's what I thought. You're a real go-getter, aren't you? Okay, so go ahead and put that aside. And next we're going to move on to testing your accessory nerve. Just going to be testing some stuff in your shoulder girdle muscles, okay? To begin with, I'm going to be placing my hands on your shoulders. Now, first I'll just be resting them there. I'm going to ask you to lift your shoulders and relax them a couple times, okay? Then we're going to do it again with me placing a little more pressure, okay? So, if it's all right with you, I'm going to go ahead and place my hands on your shoulders now. Okay, just resting my hands on your shoulders. You can go ahead and lift them up, up, up. Great. Okay, drop them, let them relax. Good. Up again, lift your shoulders up. Beautiful. And let them relax. Perfect. Okay, now in a moment I'm going to start giving some gentle pressure, pushing down, not super hard, it shouldn't hurt. I'm just going to press down, and I want you to press against my hands, lifting up, okay? So I'm pressing on your shoulders, pressing. Go ahead and lift your shoulders up, 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 up. And drop them. Good. That was perfect. And, okay. I'm going to go ahead and place my hands on either side of your face, if that's all right. Okay. So place my hands right here. Can you go ahead and turn your head all the way to your left? Good. And all the way to the right. Good. Okay, that was beautiful. Look at that, we've already gotten through 2 of the cranial nerves. Can you guess which one we're moving on to next? Well, if you guessed hypoglossal nerve, you're correct. So, for the hypoglossal nerve, we're basically just looking at some tongue movements. So if you could relax your jaw, stick out your tongue, just okay, and if you can keep it out for a moment, I'm just going to examine it for any signs of atrophy or asymmetry, but it's looking pretty good. Like a nice healthy tongue. Okay, you can put it back in your mouth. Take a quick note. Bilateral. Okay. Can you stick your tongue out for me one more time? Good. Now move it to one side. Move it to the other side. Beautiful. Okay. You can put your tongue back in your mouth. I mean, you don't have to, but most people are more comfortable that way. Okay. Moving on to the glossopharyngeal and vagus nerves. Where are we? Okay. So, just a quick question. Do you have any concerns about your sense of taste? Has that been an issue for you at all recently? Okay. And is that something you've ever had an issue with in the past? Okay. Now, to begin with, I'm going to ask you to stick your tongue out for me again. Let me turn my pen light on here. Okay, stick your tongue out and say, ah. Nice big ah. I'm just going to look in here. One more time. Nice big ah. Good. Beautiful. Okay. Put your tongue back in your mouth if you would like. Can you repeat after me, please? I'm going to try and get a couple different sounds out of you. Can you say ka, ka, ka? Say it a few times, please. Ka, ka, ka. Okay, that works. And now, can you say go, go, go? Just say it a few times for me. Go. Alright. Beautiful. Just a moment. Alright, so moving on to your facial nerve, that's cranial nerve number 7, in case you're taking notes. So these are the nerves that innervate your facial muscles. So to begin with, I'm just going to be observing your face for a moment, looking for facial asymmetry, involuntary movements, visible muscle weakness, tremors, things like that. So if you can just look straight ahead, kind of try to line your nose up with mine. Okay, I'm just gonna take a look. Okay, and of course, no one's face is perfectly symmetrical. I'm just looking for anything unusual that wouldn't be explained by your known medical history. You've got a great face. Everything is looking really nice. Okay, so no signs of concern. Okay. Can you go ahead and I'm just going to give you a few instructions now, okay? Some facial exercises. Can you raise your eyebrows up as high as you can, please? Okay, thank you. And you can relax them. Can you go ahead and frown for me? Just give a big, dramatic frown. Okay, beautiful. Happy with that. Okay. Now this one's going to involve me touching you again in a moment, okay? But not yet. First, I'm just going to ask you to close your eyes gently. Go ahead and close them gently. Good. And now squeeze them shut. Good. Open them again. Alright. So just so you're prepared, because I'm going to be touching you with your eyes closed. I don't want to make you jump. I'm going to ask you to close your eyes again. And I'm going to place my fingertips just on your upper and lower lids here, okay? I'm going to ask you to squeeze your lids shut once again, okay? I'm going to gently try and open your eyes. Again, it won't be hard. It's not going to be painful or anything. Just very gently going to try and encourage them open, and I want you to fight me, okay? Keep your eyes squeezed shut against this, okay? Great. Okay, so go ahead and close your eyes. Squeeze your eyelids shut. Squeeze, squeeze, squeeze. I'm going to start trying to pull them apart. I'm going to try to open, 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 but keep squeezing, keep squeezing, keep squeezing. And relax. Beautiful. Okay. Can you show me your upper teeth, please? Just lift your lip. Good. Lower teeth, just... Okay, good. Can you give me your biggest, brightest, most foolish, dramatic smile that you can? Great big smile. Okay, gorgeous. Go ahead and relax your face. Okay. And finally, can you please go ahead and puff out both cheeks for me, just like that? Okay. Hold it. Great, you can go ahead and relax. Just going to take a few notes, and then we'll move on to the next thing. Relationship. Progressive. Is Good. Okay. Just a moment. Alright. I assume you've seen one of these before. This is called a Snellen chart, and it's for testing your visual acuity, mostly, which is just how well you can see from a distance. So I'm going to be holding this up. I'm going to ask you to tell me what some of the different letters are, even if they're difficult for you to see, or even if they're just blobs. If you could do me a favor and give me your best guess, that's all I need if you're not sure, okay? So we are going to, oh, and this down here just tests your red desaturation. Is it clear to you that this one down here is red? Okay, good. Just note that real quick. Desaturation is a pass. Okay. Oh, yeah, this one tests your ability to see interdimensionally, but that's not part of this test, so don't worry about it. Okay, so I'm going to hold this right about here, okay? If you could go ahead and just tell me, what's that one, please? Okay, great. And this one, can you read this line? This one, that. Okay, good. Can you go down to this line here? 1, 2, 3, 4. What are those letters? Beautiful. Okay. Now, if you wouldn't mind, I'm going to ask you to cover up one eye. Doesn't matter which one we start with, just go ahead and fully cover up one eye. I'm going to try again. Okay. So, starting again at the top here. What's that, please? Good. Next line down. Good. And the next line down, can you actually read this one backwards, starting here? So 1, 2, 3. What are those? Beautiful. And this one down here, what are those? Good. You can go ahead and cover up the other eye now. Same thing, just we're going to swap sides, okay? So, with that other eye covered, can you tell me the first one? Good. I'm going to go right down to this line. 1, 2, 3. What are those, please? Good. And down here, can you read this backwards, please? 1, 2, 3, 4. What are those? Beautiful. Very happy with that. Visual acuity is okay. 20. Okay. I'm gonna check your visual fields real quick. So this one again, we're gonna start with both eyes open, and then we'll cover them one at a time for the next two parts, okay? So what I'm going to be doing is I'm going to be kind of checking your visual fields and basically how far out the periphery of your vision goes, okay? So I'm going to take this pen here, and I'm going to start wiggling it in to your field of vision. I want you to look straight ahead, look at my nose as best you can, keep your eyes fixed right here on my nose. And then while looking at my nose, just let me know when you can see the pen come into your field of vision, okay? You can raise a hand, you can say now, you can indicate in whatever way you'd like. Just keep your eyes on me and let me know when you can see the pen, okay? Good. Again. Beautiful. Good. One more time, looking right here. Okay, great. Okay, we're going to stick with the eyes, but we're actually moving onto a different cranial nerve in just a moment. Can you go ahead and cover one eye? We're just going to do this. Yep, cover one up. Looking right here, we're going to do that. Good. Beautiful. Keep looking right here with that eye covered. Good. Right here. Beautiful. Okay, can we swap? Cover up the other eye. Good. Once again, looking right here. Gonna bring it in. Okay, let me know when you see the pen. Good. Right here. Beautiful. Okay. So now we are going to I'm going to do all three in one, okay? We're going to test the oculomotor, trochlear, and abducens nerves. And these are the nerves that control ocular and extraocular movements, pupillary response. So for the very first one, I'm going to ask you to hold your head still, okay? Both eyes open. Look at my nose to start. Okay. Now I'm going to ask you to look right here at the top of this pen, okay? Keeping your eyes here. I'm going to be moving it a little bit as best you can. Just try to keep your eyes fixed on this one point, okay? Okay, so following it. Good. Following it. Beautiful. Okay. Follow. Good. Okay. Okay. Once again, taking a look up at the tip there, top of the pen. Good. Now it's going to be moving away. And then it's going to come in close. Keep your gaze fixed on it. Good. Okay. Once again, looking at the top there. Keep your eyes fixed as it moves away. And back in. Good. Alright. Happy with the accommodation reflex. And I'm gonna grab my pen light again. Okay. I'm gonna ask you to pick just any point over my shoulder and keep your eyes fixed on that. I need your eyes fixed on a point far away. I'm gonna get quite close. I'm gonna be kind of shining this light just obliquely into your eyes. Try to ignore the light as best you can and just keep your eyes back there, okay? So I'm gonna get in quite close. Pick a spot. You got your spot? Beautiful. Okay. I'm gonna get up in here and just gonna look real close. This eye first. Keep looking back here, please. Good. Gonna move over here. Pick a different spot if I'm blocking it. Just keep looking in the distance. Good. Okay. And you are doing an awesome job. Getting everything I need here. Okay, people respond. I'm going to do a little swinging flashlight test, which sounds probably more fun than it is. I'm just going to be asking you to pick a point, again, kind of stare off in the distance. I'm going to be taking this light, going to turn it on, and I'm going to be moving it back and forth between your eyes, just looking at the way your pupils respond. You don't really have to worry about doing anything other than letting your gaze relax on some point in the background, okay? So, if you can go ahead and let your eyes relax, fix your gaze to a point behind me. I'm just going to start over here. Blink if you need to from time to time, but do your best to keep your eyes open. Good. Okay. Just try to make sure that your pupils are contracting and dilating appropriately. And we are looking really good. Okay. You can relax for a moment. Just gotta take a few notes here. Alright, and we are just cruising along here. Have you been keeping track? How many cranial nerves do we have left to test? We have 2. We've got the trigeminal nerve, which we'll be doing next, and then we'll be wrapping up with your vestibulocochlear nerve, okay? Yeah, I know that's everyone's favorite, that's why I save it for last. Okay. So I'm going to begin by testing your light touch. I'm going to take this cotton swab right here, and I'm going to very gently just kind of poke you with this soft, fluffy tool. A few different points on your face. Again, I'm not trying to trick you or catch you up, so I'm going to let you know when I'm doing it, okay? I'm going to say touch, and I'll touch you. If you cannot feel it, or if you can just barely feel it, it's not going to be hard, but it should be a clear and noticeable feeling, okay? So as long as you feel it, just go ahead and say yes, or give me a thumbs up, or raise your hand, just anything to indicate that you did feel it. If you didn't, either it's a no or a not really, let me know that too, and I'll keep that written down for your notes, okay? Okay. So, if you can just relax, I'm going to start with your forehead here. I'm just going to touch. Touch. Okay. Touch. We feel all that? Okay. Your cheek. Touch. Touch. Okay. Your chin. Touch. Touch. Okay. Good. Your jawline in a couple spots. Touch. Touch. Your nose. Touch. Got it? Great. Okay. So this next one's going to be very similar. I am doing it with a sharp object, but I want to assure you I'm going to be very gentle with it. It is just pointed enough that it will activate the necessary nerve endings, okay? It's not going to cut you or harm you. It shouldn't really even feel uncomfortable, but you will be able to feel it. Again, I'm going to be saying touch, and you just indicate yes or no if you feel it, okay? Great. Okay, so starting with your forehead, I'm going to touch, touch, touch. Is that good? Great. Okay, I'm going to get under your cheek. I'm going to touch. Another side, I'm going to touch. Okay. Your chin, I'm going to touch. Okay. Your jawline on this side, I'm going to touch. Touch. And on this side, jawline, I'm going to touch. Touch. Okay. Your nose, I'm going to touch. Are we all good? Great. Okay. More of the same. You have different types of nerves that register different types of sensations. So we're just running through those right now, okay? I have a tuning fork here. I'm not going to be using it to make any noise. It's just a nice kind of metal that stays nice and super cold. So I'm going to be touching that to those same spots. It should register as this kind of refreshing cold feeling, okay? Same drill. I'm going to gently touch, 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 touch. And you'll just let me know yes or no if you feel it, okay? Good. So starting with your forehead, just gonna touch. Nice and cold, right? Okay. I'm gonna touch, touch. Okay. Let's get your cheek on this side. Gonna touch, touch. And on this side, your cheek, we're gonna touch, touch. Your chin, gonna touch. Good. Jawline. side. We're gonna touch. Touch. Good. Okay. Okay. No special tools for this one. I'm just going to be using my fingers to gently touch the sides of your face. I'll be doing equal pressure on both sides in a few spots. Please just let me know. Same. Say same or give me a thumbs up if it feels the same on both sides. But please do let me know if you're only feeling it on one side or if it's super noticeable that it's feeling more on one side and not on the other, okay? Great. So I'm just going to begin here in your forehead. I'm going to press. Does that feel even? Good. On your cheeks, I'm going to press. Does that feel about the same on both sides? Good. Both sides of your chin here, I'm going to press. Does that feel good? Same on both sides. And your jawline, I'm just going to press. Good. How are we? Beautiful. Let's go ahead and check your muscles of mastication. Can you please, it's just your jaw muscles, your muscles for chewing. I'm going to ask you, don't do it too hard so that it's uncomfortable, but if you could just gently clench your teeth together, kind of grip them. I'm going to place my fingers on either sides of your jaw, if that's alright. I'm just going to gently, go ahead, yeah. Grip your teeth together, good. I'm just going to gently massage and palpate the chin and jaw. Checking those muscles, make sure they feel strong. Okay, feels really good. You can go ahead and relax. Okay. Can you go ahead and just open your mouth for me like you're giving a great big yawn? Good. Okay. Now open your mouth as wide as you can. Good. And then move your jaw to one side. Good. And then the other side. Beautiful. Thank you. Okay. Just going to check your jaw jerk reflex real quick. I'm basically just going to be, placing one finger on your chin right here. And then I'm going to be tapping it with the other finger. It's going to be just enough to initiate a small reflex. You can just relax, okay? I'm going to place my finger right here on your chin. Just gonna... Got it? Okay, one more time. Good. Okay. Just one moment while I write a few more notes and we will move on to the final section, okay? Okay, so moving on to our last section, the Vestibulocochlear Nerve, which controls your vestibular function and hearing. Vestibular function is balance, among other things. I'm going to ask you a few questions regarding your vestibular function. I'm going to list some symptoms. These are all things that most people experience occasionally. Once in a while. I just need to know if you experience any of them frequently enough that it's concerning for you. Okay? Just use your best judgment for that. I just need to know if you experience any of them so intensely that it's causing like a functional problem in your daily life or causing you anxiety. Okay? Such as the simple yes or no. Okay? So, have you recently had any concerns with feelings of dizziness? Okay. So have you recently had any problems with feelings of feeling off balance? Yes, no, on a 1 to 5, it's a yes. Okay. How about blurred vision in both or one eye? Okay. Any problems with falling down or stumbling? Yes or no? Okay. Feeling as though you are floating? Is that something that you've been running into? Okay. Feeling as though the world is spinning around you. Okay. And finally, have you recently had any problems with feelings of feeling just generally disoriented? Okay. Now, just a couple of hearing tests to wrap up. I'm going to cover one ear. I'm going to place my hand right over your ear, and then I'll lean into the other ear, and I'm going to whisper some numbers. I just want you to repeat the numbers that you hear me whisper, and I'll do it on the other side, okay? Alright, so I'm going to put my hand on this ear, your left ear to start, and I'll lean into your right ear. Okay, so we're just gonna... Alright, my hand's going over your left ear. And now if you can please repeat the numbers that you hear me whisper. 2, 12, 8, 22, 14, 37. Good. Great. Same thing on the other side. I'm going to put my hand over your ear and lean in. Alright, you're going to feel my hand on your right ear. Repeat after me, please. 9, 4, 18, 22, 1:45. Okay, great. Alright, for this second to last test, I'm going to ask you to close your eyes. Not yet, though. What I'm going to do is I'm just going to rub my fingers on either your left or your right side. And with your eyes closed, I just want you to let me know if you hear it on the left side, on the right side, or if you can hear it on both. Okay? Alright. So go ahead and close your eyes, please. Great. Now, which side? Okay. Which side? Good. Which side? Okay. Which side? And which side? Beautiful. Okay. Now, we are going to wrap up with just a quick otoscope check on each side. I'll step over here, take a look in your ear canal on this side, then we'll check on the other side, and then we'll be done. Alright? So, let's go ahead and... Alright, so you're just going to feel the tip of the otoscope entering your ear canal right here. Any deeper into the ear. Take a look at the tympanic membrane, making sure that seeing the right amount of translucence, checking for any signs of excess fluid buildup behind the eardrum, checking the visibility and condition of physical structure behind the membrane. And I'm really happy with what I'm seeing, so okay, I'm gonna go ahead and remove the otoscope. Beautiful. And again on this side. Okay, otoscope entering your ear canal right here. Good. Once again, starting with the ear canal itself, checking for any redness or signs of irritation. I'm not seeing anything to be concerned about. Looks pretty clean, healthy. Good. Okay, moving a little deeper into your ear. Taking a look at the tympanic membrane. Once again, we're looking really good. Not seeing any signs of irritation or infection. Normal, healthy eardrum. Water can see through the membrane is looking good too. Okay. I'm really happy with what I'm seeing in here. Okay. Gonna take one more look around. Okay, I'm gonna go ahead and remove the otoscope. Good. Alright, well, that's it. Thank you so much. I am so pleased with all the results that we got. I'm going to review them all very carefully, and I'll let you know if there's anything I want to follow up on or write you any referrals for. But overall, I'm very pleased with how this went. Thank you so much for coming in, and you're such a joy to work with. I do look forward to seeing you at our next appointment.